Thank you, Presiding Officer. There can be few things more important than the safety of patients in our health service. One thing that is perhaps equally critical is the trust that we as individuals and communities can have in our healthcare. Patients must also have trust that where concerns are raised about their care and treatment, those will be investigated and the necessary actions taken. They must be able to trust that their concerns will be investigated, scrutinised and subject to robust governance and due diligence at the time and not several years later. When trust is broken and such weakness in governance identified, it's imperative that we do all we can to investigate why and do all we can to prevent others from having the same kind of distress and traumatic experience. The actions some years ago by Mr Eljamel, a former surgeon in NHS Tayside, have been discussed at length in this chamber, and I know colleagues have a keen interest in the government's next steps. Several reviews have taken place into his practice, both at the time and in the years since, after concerns were expressed by a number of his former patients. The latest NHS Tayside review, due diligence review of documentation held relating to Eljamel, laid bare the failings in NHS Tayside response to concerns about Mr Eljamel. It is clear from the review that these were not acted upon or followed up with the urgency and rigour that they deserve. Now, several years later, many former patients still live with the consequences and still have many unanswered questions. That is why today I am announcing our intention to commission a full public inquiry to seek answers to those questions. Mr Eljamel practised as a consultant neurosurgeon at NHS Tayside between 1995 and 2013. Concerns about his practice were first raised to NHS Tayside in 2011 and in 2012. As a result of a complaint received at the end of 2012, two further complaints received in 2013 and two significant clinical event analyses, NHS Tayside commissioned the Royal College of Surgeons in England to review his practice. Most complaints were received after Mr Eljamel had been suspended in 2013. Since then, several reviews have taken place into his practice. Members will know that one of my predecessors as Health Secretary, Jean Freeman, commissioned in March 2021 an independent case note review on outstanding concerns of two former patients. This reported in May 2022 and made several recommendations for NHS Tayside, Scottish Government and for NHS Scotland. In response, NHS Tayside commissioned the due diligence review in March of this year. And this was considered by the Board on Thursday the 31st of August 2023. I will say more about the detail of this review in a moment. In the months while this work was being undertaken, several former patients continued to raise concerns about their prior care and treatment. This was done directly with NHS Tayside, through MSPs, with ministers and in the media. I have considered the concerns raised with me by several former patients, and I have been struck by their bravery and their persistence, sometimes accompanied by significant distress and compounded by trauma. Nevertheless, I was not at first persuaded of their argument that only a full public inquiry would find the answers they sought about what happened to them and why. Knowing the length of time that could take, and knowing that it would not necessarily consider each individual patient's circumstances, I was of the view that there were other, potentially faster and more individually responsive ways to seek to answer the questions, to seek to find the answers for what they were looking for. However, As I have already touched on, after considering the findings of the due diligence review, my view has significantly changed. I'd like to offer some detail on the due diligence review process and what specifically it found that has informed my thinking. Earlier this year, NHS Tayside began to examine their own handling of these concerns. Last Thursday, their board considered this report. It outlines a number of failings that I believe can only be examined thoroughly by a full public inquiry. It also brings forward significant information not previously known to the Scottish Government. Given the length of time since the first concerns were raised about Mr Eljamel, this raises real concerns. Briefly, the due diligence review identified that NHS Tayside did not respond to the General Medical Council about Mr Jamal's request for voluntary erasure from the medical register, that there were no effective central board oversight or coordination of significant historical information or reviews into concerns. It identified multiple examples of reviews and investigations where there was no follow-up action recorded and no or inadequate scrutiny, assurance or supporting governance. It identified cases where, despite there being complaints, adverse events reported and legal claims, no formal review of cases have been documented or retained. That documents of potential relevance were subject to destruction in accordance with routine retention periods, when putting a hold on such destruction would have better supported subsequent review processes. It identified adverse events where no investigations can be identified and no reports of adverse events were formally recorded until several months following the incident, and that communications and support for former patients was not consistently of the required standard. I have reflected on the concerns of former patients and MSPs since the findings were considered by the board of NHS Tayside, and I'm clear that the board's governance obligations were repeatedly not implemented in respect of concerns about Mr Eljamel. I consider that this now means that the commissioning of a full public inquiry under the terms of the Inquiries Act 2005, with the powers to compel witnesses, is the only route to get to the bottom of who knew what and when and what contributed to the failures described by NHS Tayside. Let me say at this point that I know that this will inevitably be a lengthy process and that, as I said earlier, a full public inquiry will not necessarily answer the individual clinical questions for each former patient about their own particular circumstances. For that reason, I still do consider that an independent case review of patients' individual clinical cases, where that is what individual patients want, remains necessary. This will allow a person-centred, trauma-informed review of each patient's own clinical case, addressing their individual needs and circumstances and attempting to offer answers in a bespoke and personalised way that an inquiry will not. There are former patients who are still living each day with the consequences of their treatment by Mr Eljamel, and addressing their personal needs in an individual clinical review that is conducted independently of NHS Tayside remains an important part of this process. I want this to begin as soon as possible and not to be delayed by the announcement of our intention to commission a public inquiry. Presiding Officer, for the sake of those patients directly affected, for the confidence of the community in Tayside and for the promotion of patient safety more broadly across Scotland, I now believe a full public inquiry is needed. I have now asked my officials to begin to make the necessary arrangements, and I will continue to update Parliament as these arrangements progress.